I would like to welcome everybody to our three-part webinar series taking place throughout April, May, and June. My name is Jordan Hines, and I am the new initiatives coordinator at the Epilepsy Association of Western and Central PA. The series is going to be guiding participants through the GOT transition 6 core steps of healthcare transition. Each step will take about 10 minutes, and we'll have time for questions after each step. We have a fantastic lineup of expert transition speakers to help your family begin the process of taking control of their healthcare management to plan for the future. This month's webinar is titled Building Bridges, which will cover the steps 3 and 4, preparing and planning. Our featured presenter today is Dr. Andrew McCormick, who is an associate professor of pediatrics at Children's Hospital of Pittsburgh and is recognized as a local and national expert in healthcare transition. And we also have Dr. Miya Asato, who is associate professor and pediatric neurologist at Children's Hospital of Pittsburgh, and she will be our webinar moderator. They will be providing us with some person-centered ways to ensure successful skill building towards transition. So please join me in welcoming today's speakers.
Well, Jordan, thank you so much for inviting me to talk, and Miya for asking me to give this presentation. You know, the 6 core steps that are outlined in the GOT Transitions website really is a fantastic way of thinking through the philosophy of transition. And so I'm excited to really share with you guys the steps of preparing and planning today. Before we get going into that, though, I always like to kind of talk about what is kind of the purpose or kind of the reason why we talk about transition. And I really think of this concept of something called an inclusive transition. I know everybody's heard about inclusion a ton, be it in the educational sphere, but we often don't think about inclusion from a global sphere or from a healthcare sphere. And the picture I would like to paint is to think about when your child was first born. Every parent holds their child and they think about, you know, what will my child's life look like when they're an adult? We all dream for our kids to be engaged in work that is fulfilling to them, to be in healthy relationships, to have community, to have a vision for their life of what they value. And what I mean by an inclusive transition is that, you know, when we think about inclusion, we think first about being included, which the reality is all of our kids are getting older, so they will get to adulthood. So they're going to be included as adults. But the second piece of that is not just being included, but also valued. And so really transition is this purposeful and planned process around helping our kids become adults in which their values and their ideas can be realized. So that they can integrate well into society. And when I think about that, and when I think about transition and how it's done in the American healthcare system, I think about this picture. And this picture is, once again, a pretty famous picture from the educational sphere. And it shows these kids who are trying to watch this baseball game. And I think of these kids watching the baseball game as how are we trying to help our kids integrate into adulthood so that they can be valued. And so their ability to watch the game is really kind of looking at how do they integrate into adulthood? How are their values achieved? And the first often way in which we do this is we create some equality, meaning the healthcare system creates some little systems in place that kind of push young adults along into adulthood. This example of this would be a policy that the hospital says that by this age, be it 26 or 21 years of age, all of our young adults will be pushed into the adult world. Often just having a policy like that helps some people, but very few people, because all it does is kind of pushes or ages out our young adults from kind of kid world into the adult world. And the next step in this process is really thinking about more equity, meaning how do we look at specific groups of young adults and kids and how do we build support around them. So the example of this would be having, a transition program within the neurology department of Children's Hospital of Pittsburgh that looks specifically at the needs of children with epilepsy and how do they successfully transition into the adult world, really targeting areas that are most important around them. And that's kind of what this lecture series has been around. But I actually think we even need to move beyond that and say that the fence is the problem. The problem is that there are huge system problems that lead to transition being dangerous and difficult for lots of people. And my talk today is really going to be focusing on us looking at this fence, saying what are the system problems that are going on, and how can you as parents and young adults be able to change or turn the system to be effective for you. I mean, ultimately, our goal as transition experts is to help change the system. And that's one of our goals at Children's Hospital, is to make transition more successful for all of our young adults, be it someone who has no healthcare needs all the way up to someone who has significant and complex needs. But really what we're going to try to do is take a look at this fence and say, how can you in your own individual area tweak and look at the fence to make changes? So to understand this, the first thing we have to always think about is that transition is a purposeful and planned process to move to adulthood. The main problem is that often what we get is what I call the transfer jump, meaning that kids age out. At 18 years of age, 21 years of age, people are saying you can no longer be in the kid kind of realm, and we have to push you into adulthood. And so there's been no work that's been done, and we're leaping and we're jumping towards that next place. And sometimes that gap is pretty big for people, and it's unleapable at a single point. And so that's where we see this gap, this need to build a system around it to make transition successful. But even when we have systems in place, in our current strategy, we often see that we have a rope bridge. So we have a raging river. There's no way you can just leap on your own. But there are people who've started building this path, but often it feels incomplete and it's sometimes too late. And you're not sure if that next step is going to be dangerous and difficult for you. And so what the whole strategy behind the GOT Transition 6 core steps is really thinking about how can we build a bridge well. And so this is an example of a well-built metal bridge that's crossing this chasm. And the core steps really are the way in which we build that bridge. But what I want you to understand is that transition doesn't start when you're 18. Transition is this purposeful planned process that occurs over time. So this bridge is not just this piece of metal that crosses this chasm, but really what it has is has an on-ramp. There's an on-ramp that gets our kids ready for that pathway to adulthood. And then on the other side, there's an off-ramp. And so what we see is in the initial phase of discovery, we have this opportunity for our kids and our parents to really dream about what the future will look like for them. And so the discovery phase is included in these concepts of early discussions around transition. When kids are 12 years of age, 14 years of age, in creating policy statements that are more than you're going to age out at this age, it's more of an agreement between providers and families and young adults saying, we are going to go on this process together, starting when you're 12 or 14 years of age. And we're going to follow each other on an annual basis to make sure that your young adult is hitting all the key steps in transition, as well as are developmentally ready to move to the adult world. Then we go into tracking, and tracking is really putting the metal girders up on this bridge, because what tracking is about creating a checklist of saying what are the key steps within transition that need to occur in a process to say we are both accountable to making sure they're going to happen. Preparing and planning is the next phase, which is really the bridge is really getting built now, and that's where we're going to be focusing on today. So preparing is really, are we developmentally ready? Have we hit those developmental milestones to be in the adult world? And if we haven't, how can we create goals to get there? Planning is creating a transition plan to make sure that we're going to successfully get to the other side. And then we have transferring and completing, which is the off-ramp. So once we've got to the adult world, we have to make sure that we have ways of doing checks and balances to come back if something doesn't work out well, as well as making sure that once we get to the adult world, we stay in that path in a successful way. So like I said, today we're going to really be focusing on the 2 steps of preparing and planning. So I'm going to now take a moment and go a little bit deeper into each of these specific topics. So what do I mean by preparing? Like I said, preparing is really having a developmental sense of a teenager and a young adult's readiness to move into the adult world. And this chart that I put up on the screen really kind of embodies that concept. So if we look at the top line, early in life, that means when you have your child who's really young in childhood, we know that there are key stakeholders in the care of that young adult, of that child. We have the child themselves, and they really are passive in a lot of senses. They're just receiving care. We have the parents, and these are the people who are actually delivering the care. And finally, we have the providers. And often at this stage, the providers are the experts, and they are trying to educate the parents and walk alongside the parents so that they deliver care in the right way to that child. But as that child moves forward and gets older, there's a power shift, because developmentally it's important for there to be a shift so that the young adult, the teenager, starts taking more and more responsibility. And this can be really challenging as parents, because often, in the middle stage, when our child is late elementary school, going into middle school, we have become the experts. Our physicians are now our consultants. They kind of give us recommendations, but we know our child best, and we often know all of their care and how they respond to things. And often we are very intimately involved in how care is delivered. But our kids are really supposed to be at this stage, start to become participants, meaning we should be in the process of dialoguing with them so they understand what are their medications, why are they taking these medications, what does a reaction to my medication look like? They should start be engaging in what their care looks like, because as they move into late kind of childhood, so that would be teenage to adult stage, so when they're 16, 18, even getting to the early 20s, they should be shifting from just being a participant to becoming now the managers. While the parents were the managers before, and they were the ones intimately involved in making all the decisions, it now shifts to that young adult, that teenager. They have to become the managers. And that can be really conceptually hard for us as parents, because we have to give away some of that responsibility. And now we as parents become supervisors. So we are monitoring to make sure our managers are doing a good job. We're giving them feedback, but we're really letting them to take the role of being the decision maker. And now our physician arm is really standing back as a consultant, feeding back feedback to the family to say how they're doing, what can be tweaked, making decisions along with them. Because we know that the flip, when they move into the adult world, the adult provider doesn't function in kind of a paternalistic manner, isn't going to tell you exactly what you need to do. They're going to give you recommendations, and our young adult needs to get to a place where they're the CEO. They're the one managing all the different aspects of their care, and they're really integrating with their adult provider to know how care is given the best. Because the parent really has moved to a consultant phase where they are not intimately involved in every day, but they're always there for support. So this is the paradigm of development we're talking about when we're talking about this kind of process of preparing to move into adult care. And so what does this actually practically look like? And I think about these kind of 3 steps whenever I'm in a transition appointment with a young adult, with a teenager, and thinking about how am I going to help prepare them? How am I going to make sure they developmentally are moving along? What I need to do is number 1, assess their adulting skills, meaning what are the skills that we as adults use to make sure that our healthcare is delivered and taken care of appropriately. Number 2, after we assess it, we need to create goals to increase independence. So if our young adult doesn't have all the skills they need to appropriately adult, then we need to create goals that allow moving them forward incrementally so that they can create that independence. And finally, this isn't done at a one-stop process. It is continuously 14, 15, 16, 17, 18, 19, 20, 21 years of age. We're monitoring progress, we're assessing them regularly, and we're creating goals to continue moving them forward. And that is really what preparing is about. So how do we practically do this? So what I've put up here in big red letters is TRACS. And TRACS is the Transition Readiness Assessment Questionnaire. This is the tool that I often use because it's validated across multiple different populations. It's a really great tool to sink down and say, are our young adults prepared developmentally for the skills they need to get their healthcare independently? And so I wanted to take a quick look at this questionnaire just so you can kind of get a broad stroke. And so this would be a great, so where can you get this? If you go on Got Transition's website, you can go ahead and click on their assessments page, and their TRACS is one of the assessments you can use. And so if your provider is not doing this with you, you can print this off and take it with you, and you can actually do it before your appointment and hand it to your provider and say, hey, I need help making sure that we're doing all the things we need to do to be prepared to deliver healthcare independently and as an adult. This is where I'm at. Can you work with me to create some goals for independence? And so what the TRACS really looks at are these different spheres of healthcare delivery. Medication management. Can they take care of their medications independently on their own? Appointment management, from making an appointment to knowing how you ask questions during the appointment, to knowing how you do the follow-up care, as well as making sure insurance is effectively. Tracking healthcare issues. How do I respond if something doesn't go well? What do I do if I had to communicate with my physician if something's not working out? Talking to providers. Do I communicate effectively? One thing I'll stop here. It is really developmentally important. One of the most important skills that we can help our young adults do in this process is make sure they have time alone with their physicians, that they get the opportunity to talk with their physicians, ask questions of their physicians, answer questions from their physician to make sure that they're successfully doing that well. And finally, managing daily activities, because we know healthcare is impacted by how do we function in other aspects of our life. So what I often do is have our families complete the TRACS questionnaire. I do it right within clinic. And then afterwards, what I do is I will go with them through and say, hey, everybody in this room is a key stakeholder in making sure this young adult, that this teenager is successfully getting to the adult world. We're going to each look at this assessment, and we're going to create one goal each to say, how can we move towards independence? This is really important because our young adults need to hear their parents say, hey, I want you to become more independent. I'm encouraging you towards goals of independence, because it's often that our young adults and teenagers are ready to go. Sometimes we are less comfortable with that. So how does that practically look? So this is an example of a questionnaire that one of my families filled out, an example of a set of goals that we created together. And I'm going to highlight specifically one of the goals and say one of the things that our young adult wanted to do was to learn to take their medication independently. This is really key because often medication is so linked in understanding, to have health literacy, to understand your health situation. It's fundamental that our young adults learn this key skill, medication independently. But what we don't do is we make a list and say, okay, you're going to take your medication independently. We're all done. The next thing we have to do is we then have to operationalize how that goal looks in your life. So what I often do is say, okay, how do you guys take your medications right now? Sometimes they'll say, well, mom goes to the pill tray, opens the canister, takes one pill out, puts it on the counter, and I take it. And we consider that taking medication independently. And we have to say, we need to back that up a little bit. We need to say, how can we increase education around understanding our medication and understanding our health literacy? So I'll make simple assessments and we'll say, hey, okay, number one, let's buy a pill tray. We'll take a pill tray, and once a week, mom, dad, and young adult are going to sit together and fill this pill tray, so that they can do some one-on-one education. This pill is for your seizure medication. This pill is for your hypothyroidism. This pill is for this. And you're filling this tray out together. The nice thing about that is then they have a system that they can build on in the future. So if a new medication comes in, they can add it to the pill tray. The pill tray is then used on a daily basis so that our young adults can learn to take their medications morning, evening, lunchtime themselves. The nice thing it also does is it allows us to say, when is our medication going to run out? If you fill a pill tray 1 week in advance, you know 1 week before when your medication runs out. So you can think about, how do I deal with refilling my medication? That gives you another step to say, how do we refill our medication? What can we do? So we really kind of say, what are we Where are the gaps in my health literacy, my health education, my developmental readiness to take care of myself independently? Then we create true operationalized goals around that. And the last thing that I often do, and Jordan, I can actually send you the PDF of this if you'd like, if families would like this. This is the Teen Guide to Medical Transition. It was created by partners at Children's Hospital and Carnegie Mellon University. And we created this teen guide to mirror the tracks. And what it does is it says, based on different goals that we're shooting for, what are different workbook skills we can work on to kind of process down. It allows you to kind of operationalize some of those goals yourself. So this is just an example. So one section is me and my health and my body. And in that section, it allows you to say, how do I talk to the doctor? And it gives you a little bit of ways in which you can kind of practice before you go to the doctor. What are the things that I need to be thinking about? What kind of lists can I make? It has sections on how do I prepare for an appointment? You know, we aren't born with the ability to say, I need to make a list of questions I have for my doctor. I need to make sure I take my medication with me. I need to have some backup mechanism for when my doctor's running really, really late. I don't get bored. I don't get detached. I have something I can do with my time. It has a section on what do I do about my medications? What are the questions we need to be asking? What do I do when I have a side effect? Who do I reach out to? What are those key phone numbers I need to know if something doesn't go right? So we can see the preparing phase is really all about assessing the adulting skills of our young adult, saying, hey, where are their gaps in their health literacy and their readiness to move to adult healthcare? And how can we create goals to individually create goals for success in that? The next stage we're going to move into now is the other piece of that, which is the planning phase. And like I said, the planning phase is kind of moving past just having kind of that developmental readiness, but it's actually saying, how can I create a plan, a mechanism for how I'm going to know what transition looks like for me? Once again, we have the transfer jump. We don't want that. We don't want transition to occur when we're 18, 19, 21 years of age. We want to do it much, much earlier. We want transition. We want a purposeful and planned process to make sure that we get to the adult world successfully. But one of the things that often is very difficult, and why I talk about it right now, is because it's really about how do I flesh out my transition plan, is that often transition is done in silos. I've talked a lot right now about healthcare transition, but the reality is at the same time, your school is talking to you about educational to employment transition. You know, you may have a lawyer who's working with you thinking about financial and legal transitions. And probably not a lot of people are talking about, but the importance of community transition. When our young adults graduate high school, they're going to change communities. And what does that look like? And how do we do that successfully? And often right now, if we're looking at defensive transition, the problem is this is all done in silos. Everybody focuses on their little bit, but we don't do a lot of integration and overlap. And so we really need to change the focus of what transition should look like. And I really think of this as the transition puzzle, because the reality is that each of these areas are pieces in a transition puzzle. Healthcare, community, finance, employment, legal. If any of these areas are missing, just like if you did that 2,000-piece puzzle while you've been on COVID, stay at home, if you're missing that one piece of the puzzle, the whole puzzle looks incomplete. There's that glaring piece that's missing. It affects everything. Because the reality is that one piece of the puzzle is touching all the other pieces. Let me give you an example. Let's say you have an excellent transition from school to working. You've done a great job, and your young adult has really integrated well, and now they're an adult who's in the workplace. But we've done a really, really lousy job as a healthcare system, making them successful for integrating and taking care of their own care. And now we're having a ton of breakthrough seizures because they're struggling with managing their medication. Their insurance coverage has changed, and their medication isn't giving coverage, so there's a gap. And now they're struggling because we're having breakthrough seizures. That affects their ability to stay in the workplace. And if they're not in the workplace, that affects their way of staying employed. And we know that then affects what's going on financially, what's going on legally, their ability to drive independently. We can see how all of these seep and touch each other. So we have to look at them together. So when we think about a transition plan, we think about it much more holistically. We have to think about how it touches everything. Now, that isn't to say that there is one provider who does it all. As a physician, my goal is making sure healthcare transition is done very successfully. But I am also responsible to check in and make sure that there aren't gaps in educational to employment transition, community transition, legal transition, financial. So I'm assessing those and pushing off and making sure there's support in other areas. So we're integrating transition in a much more successful way. So what does this look like? Really, your transitional care should look like these different pieces of a puzzle as touching each other. So you're going to have these very kind of specific goals in mind that at the end of transition, we're going to be successful in having these hard documents, these kind of transition packets that are ready. So in the healthcare world, we talk about the portable medical summary, and I'll dive down into that a little bit deeper in a second. But we also have to think legally. Is there need for shared decision-making, power of attorney versus guardianship? Does our young adult need more support and needs actually a decision maker on their behalf? We also have to think about what are the different things they actually need to have to make sure they can get employed, making sure that they have those hard documents, state IDs, driver's license, social security, birth certificates. We need to have a will set up, because if we don't plan for the future, if something happens, then we won't know what we're supposed to do. And a key and important thing is how we're integrating for employment. They need to have a resume, and we need to start this early, because what we're going to be encouraging our young adults to do when they're 12, 14, 15, 16 years of age is to be volunteering, to explore the employment world. So when they get that first job, they already have a resume of people who can recommend that they are hard workers and they can show job experience. So planning is this very integrated process that angles to these very specific goals at the end. So this is a document that I use, and this is kind of a transition plan that we use in the Down Syndrome Center. And what it is a really important way of me going with families through this process and over time to making sure we're doing the right steps and making sure we're addressing the right issues so that they are successful in their transition. And that starts early. Have we discussed the policy statement? Have we made a decision together that we're going to go on this path together, and it's going to be an integrated process? I need to make sure, am I doing transition readiness assessments? I don't want to do it once. I want to do it multiple times, as well as develop goals for independence. Have I created a portable medical summary, this key document that really allows for the medical transition bridge, that transfer process to the adult world? And we'll go over that in a second. But then we have these other areas. We need to have a discussion around, what does decision-making look like? Is your young adult a completely independent decision maker? Do they need to have shared decision-making where they can make decisions independently, but they need a power of attorney who stands beside them and supports them? For someone who needs more support with guardianship, we need to be having those discussions early and often. We need to talk about, when will transfer occur? This is one of the discussions we have early in the policy statement, but I like to say we need to pick a date. We need to say, in September, when my child is 21 years of age, that is when our goal time for transition will be, for transfer will be. So that when they're at 14 years of age, we know how much time we have to do their work. And that time and date is flexible, but we at least need to put it on the calendar so we can make time for that. And then we also need to work together to say, when I'm going to that adult world, who am I going to? Part of my job as a pediatric provider is to work with families, to work through the process of saying, who will be that next neurologist? Who will be that next primary care physician that is working with you and making sure that you're successfully bridging over? And then at the very end, there's this transfer of care, which is kind of what I think of as the transition package. And make sure that we have done all the appropriate things to make sure that transition occurs in a packaged way so that when you move to the adult world, it's successful. So when we think about planning, really the portable medical summary is one of the key things that can be utilized to make that successful. Once again, on the Got Transition website, you can go there and they have Word version as well as PDF versions of this document. You can take the Word document and fill it in yourself, or bring it to your physician and ask them to help you fill this in. But this is really a one-stop document that allows information to transfer well. What do I mean by that? When you first came into children's or into pediatric care, you were probably a really young child. And then you spent 18, 21 years collecting data, collecting changes and information that occurred in the children's system. And that's probably hundreds and hundreds of reams of paper. If you took all that information, walked to a new adult provider and put it on their desk for your first appointment, they would be lost, because I would be lost. It's impossible to quickly go through that information and pull out the most important things and still have a effective conversation. So what is so key about the portable medical summary is it's the process within transition where the family and your healthcare provider come together and summarize what care looks like, so that you can have a one-page document that is able to move to the adult world, and an adult provider can look at it and have a great understanding of what healthcare looks like for your child before and now. And it allows them to be able to know where they can start moving forward. And in this document, you can see at the very top, it has these key findings of what is your insurance? Who is your legal medical decision maker? Who can the physician talk to if they have concerns or questions? This second box, I really think of as who am I? It's the box that allows you to share with your next physician about what are the things that mean most to you. So I include things of what are the kind of skills that I have in daily activity living? What are the skills I can do independently on my own? So the physician knows how kind of functioning independently a young adult is. Pain is something I often put on there. What does pain look like for my unique individual? We know pain is a physiologic process, but it is also a process that's unique and independent to each person, and we express it differently. So it can be really important to clearly express what pain looks like. Communication. What is the best way in which my young adult communicates? What are their strengths? What are their struggles? And preferences. If I was going to have a first conversation with your young adult, what are the things that are allowing me to have a quick conversation starter? What's their favorite team? What are the things they like to talk about? What are their interests? So that we can start a conversation strong. That section is key because it allows that physician to know how they can engage your young adult immediately. Then we really get into the medical information. What are their allergies? What are their list of healthcare problems? So an example would be seizure disorder. And under that, your healthcare provider is going to put a very brief statement of their seizures are well controlled. Their last EEG was blank, and it showed this. What are their current medications? Have we had to do any dramatic changes in medications over time? So that first provider can have a good sense without diving deep into the documentation of what kind of their healthcare problems and struggles are and how they've been managed. A list of medications is next, and then medical equipment. Maybe your young adult has a vagal nerve stimulator. It's important to know when that was, when it was placed, what are its settings, immunizations, family history, and then the last section is really a list of providers. And this is really key. So this is where key stakeholder pediatric providers put their name and their phone number and address. And this allows for that check back process. So when it's a young adult is meeting that neurologist for the first time, they've got a great document, but they still have gaps and they can't find the answer. They know who they can go back to, who's the provider they could reach back to engage and ask questions if they need. So this is really a document that starts when you're young and builds over time so that when you graduate to the adult world, you can successfully transfer information and set our adult providers up for success. So we've covered a lot of ground today. I've talked for about 25 minutes, and I'm free to answer as many questions as possible. But I want to really end this by saying this transition process is a very important process. It needs to be changed not just on an individual, but a system level. But I also want to encourage you that it's a journey. Each transition is going to be unique to the individual, but I want us to remember, just like graduating from high school is a big event and is exciting, graduating to the adult world needs to be a big event and exciting. So I want to read this last quote by Fred Rogers because I think it summarizes transition so well. Transitions are almost always signs of growth, but they can bring feelings of loss. To get somewhere new, we may have to leave somewhere else behind. So while transition is exciting, it can be challenging, and it can also make us nervous, specifically as parents, as we let our young adults engage in independence. But we need to let them have some freedom and realize fear and the scariness of it is part of the process, but our kids are going to be successful if we create these really strong bridges around them that will support them as they move into the adult world. So Jordan, I want to thank you for this opportunity to talk, and I am happy to answer any questions that are there. So I know that Dr. Asato is going to kind of monitor the chat and kind of ask questions as she thought fit.
Sure, we don't have any questions yet on the chat box, so I encourage people to put them in there. But I thought, Dr. McCormick, if you could talk a little bit about the transition clinic and the adolescent medicine program and how parents might be able to utilize that as a resource in case their neurologist isn't able to provide some of those bigger conceptual pictures that you were talking about.
Yeah, thank you, Dr. Asato. I think, it's really important because, like I said, often we've had that paradigm that we are relying on individual clinics to have the full solution around transition, and we really need to move to a system approach. And one of the system approaches that Children's Hospital is doing is at our adolescent medicine clinic. These are the doctors who've been trained in care around young adults, have created a special transition clinic. And in this clinic, you can sign up, and it looks like Dr. Asato just threw up the phone number for that clinic so that you can look at that and engage in that clinic yourself. But the nice thing I really love about that clinic is it really does take this approach. Dr. Loretta Mateo is the physician in the clinic. We also have social worker Caitlin, who they work together as a team to say, what are the needs for each individual around transition, and they try to then build support around it. I'll also say that one of the supports they also have is the Pitt Health Law Clinic, is a clinic that provides some legal support around transition, and they have partnered with the young adult clinic to give some of those legal supports. Tomar Pearson Brown is the lawyer. She's a professor of law at Pitt, and she supports the Pitt law students to help engage in some of those really difficult discussions around IEPs, around legal decision-making, and sometimes we'll actually even do some pro bono work depending on the needs of families and their capabilities to kind of support that. So I would highly encourage the Adolescent Transition Clinic. It's a great resource. It's hard to build a transition program for every single clinic, but when a system creates transition as a culture, that is really what we need.
Do you have any suggestions about how to engage youth who may not perceive the urgency of transition? Some tips and tricks you might have found through your practice, Dr. McCormick?
Yeah, so number one, I think that one of the most key ways you can engage a young adult in this discussion is, number one, letting them have independent discussions with their physicians, because I think that when they get in that one-on-one situation and they start dialoguing, it can be a process of them realizing how much do they rely on mom and dad. I've been in tons of visits where mom and dad do a lot of the talking and the young adult's sitting there and they think that they're part of this process, but they haven't. But we really need to put them in a safe way of engaging. Number two, once again, the adolescent clinic, these are physicians that are exceptionally skilled engaging young adults. And then we've also started building some platforms through apps that are going to try to engage, so that for number one, I know Carnegie Mellon and a group of developers are working on an app around that transition workbook, because we often find that workbook doesn't engage all of our young adults. Some of it's too childlike, and an app can engage them more. And I also know that some of our providers within Children's are working on a transition app itself. So the more that our young adults can kind of receive transition care on the format that they like, as well as forcing them into kind of feeling what that transition will be like, can be an important way.
I would just add that, now that Children's Hospital is offering remote or electronic visits, this can be a time to try to engage your epilepsy provider to see if you can have some of those conversations, because there may be some opportunity to do that via telemedicine. So, I would consider reaching out to your care team to see if you can have some of these initial discussions about transition.
I agree with that completely.
Okay. It looks like we've addressed all of the questions within the chat box. So I just have a few closing comments and resources that I'd like to bring up as we come to a close here. If you look in the chat box, Dr. Asato and myself have listed a few helpful resources and links. So I recommend you checking them out. One in particular is the Epilepsy Association of Western and Central PA's healthcare transition webpage, and that can be found at eawcp.org/healthcare transition. And there you'll find many resources to get you started on your journey through pediatric healthcare, and we recently created several short educational videos that focus on transition. Some are specifically for youth, some are specifically for parents. And you also find many other helpful resources that are useful as you navigate through that transition, which will include the recorded presentations of every one of these webinars in the series. So as we come to a conclusion here, we've learned a lot about planning for healthcare transition today. Our fantastic speakers have provided us with important steps to help navigate through the process of healthcare transition. And I want to acknowledge them and thank them for their efforts. Dr. Andrew McCormick and Dr. Miya Asato, we really appreciate your willingness to be a part of this event. I really hope that you'll be coming back and joining us for the final presentation in this series. Dr. Anto Bajic will be presenting From Takeoff to Landing, and that will take the steps transferring and completing steps 5 and 6 on Friday, June 19th, 2020 at noon. In closing, I would like to thank everyone who registered for today's webinar and made transition a priority in your lives. I wish you all the best, and I hope to see you again at the next webinar on June 19th. Thank you, everyone.